Signs of Crohn's disease every woman should know about. Named after Dr. Burrell B. Crohn in 1932, Crohn's disease is a chronic disorder that affects the gastrointestinal (GI) tract, according to the US-based nonprofit Crohn's and Colitis Foundation. Crohn's disease is one of a number of inflammatory bowel diseases. To get Dr. Sebi approved for this gut problem, click the link below or visit www.veganchoicefoods.com. People often mistake Crohn's disease for another inflammatory bowel disease called ulcerative colitis, but there are a few key differences. One is that women are more likely to get Crohn's disease, according to research published in the academic journal Inflammatory Bowel Diseases. Another is that ulcerative colitis only affects the colon, whereas Crohn's disease can affect any part of the GI tract. What is Crohn's disease? According to the U.S. National Library of Medicine, Crohn's disease is an abnormal response where the immune system mistakenly attacks healthy bacteria in the GI tract and causes excess inflammation. This usually affects the intestinal walls in the lower part of the small intestine and portions of the large intestine, the colon, but inflammation can happen anywhere in the digestive system from the mouth to the anus. Science doesn't know the exact cause of Crohn's disease, but the U.S. National Library of Medicine says genetics are a main cause. There may be some lifestyle factors, as well. Research suggests cigarette smoking doubles the likelihood of developing this disease. Symptoms. According to the Mayo Clinic, there are a number of signs and symptoms that signal Crohn's disease. These include diarrhea, fever, fatigue, abdominal pain and cramping, blood in your stool, mouth sores, reduced appetite and weight loss, pain or drainage near or around the anus due to inflammation from a tunnel into the skin, fistula. Complications. Crohn's disease can lead to fissures, or tears, in the lining of the anus, says the health website Healthline. This can cause bleeding and pain. Sometimes, inflammation and scar tissue can even block the intestines or cause ulcers. Hugh James Freeman, MD, says there's an increased risk of developing colon cancer from Crohn's disease in his paper for the World Journal of Gastroenterology. He also says detection of colorectal cancer may be delayed with a worse prognosis. Women and Crohn's disease. A 2013 study in the International Journal of Women's Health dispelled myths about pregnancy and Crohn's disease. This study, called Crohn's Disease in Women, addressed concerns regarding premature birth, low birth weight, and congenital anomalies for children with mothers who have Crohn's disease. Researchers didn't find any evidence to support these claims. The researchers also say seeking treatment for Crohn's doesn't seem to affect pregnancy. The fear that drugs would lead to adverse effects during the course of pregnancy has led to detailed studies that have been performed regarding the safety of drug therapy among pregnant women, says the study. So far, most of these drugs have been shown to be safe, and the newest ECCO guidelines advise that there is no need to terminate therapy in pregnant women. However, researchers did note that Crohn's disease could cause hormonal changes and abnormalities in the menstrual cycle. 15 days colon/gut and digestive system cleanse. Dr. Sebi approved herbs for Crohn's disease can help you. All disease begins in the gut. Hippocrates, and remember now you can never wax an old car, so if you are sick you first need to cleanse the colon, gut and digestive tract to heal yourself. The digestive tract contains beneficial bacteria that serve as a major part, 80%, of the immune system and protect the body against harmful bacteria, fungus, and other organisms. Fasting and cleansing with Dr. Sebi approved herbs. You will fast cleanse the colon, gut and digestive tract for 15 days and then detox for another 15 days. Here is a step-by-step guide on how to complete your 30 days fast. It's so easy, families. The digestive tract is a major area for the proliferation of various diseases. The digestive tract contains beneficial bacteria that serve as a major part, 80%, of the immune system and protect the body against harmful bacteria, fungus, and other organisms. Cleansing and repairing the cells in the digestive tract and rebalancing the beneficial flora keeps harmful fungus like Candida in check. Candida overgrowth is associated with several diseases of the gastrointestinal tract, including inflammatory bowel diseases, IBD, like Crohn's disease, CD, and ulcerative colitis, UC. Candida is also associated with gastric ulcers and lupus, and it affects the whole body, resulting in diseases like vaginal yeast infection, Candida vulvovaginitis or vaginal thrush, penis infection, Candida balanitis, and mouth infection, oral candidiasis. These are also areas of herpes outbreaks. These herbs are used to restore the health of the digestive tract, and in doing so, they help to restore the balance of the whole body. Below is a list of some of the symptoms that your body may be giving you, telling you it's time for a cleanse and detox gut, colon, digestive tract, blood, liver and kidney while on an alkaline plant-based diet. Gas and bloating after meals or in between meals. Undigested food particles in the stool. Stool floats in the toilet. Stringy materials like spaghetti in the stool. Perfectly uniform round things in the stool. Black flecks in the water of the toilet. Diarrhea. Constipation. Headaches. Stomach pain. Nausea. Vomiting. Abdominal cramping. Depression. Anxiety. Can't lose weight. Poor memory. Can't sleep at night. Acne. Indigestion. Stool doesn't come out quickly. Read while having a bowel movement. Allergies. Food cravings. Hemorrhoids. Sick with colds or flu frequently. Hormonal imbalances. Body odor. Inability to concentrate mentally. Fatigue. Sexual dysfunction. Pencil-thin stools. Appendicitis. Bowel movements fewer than once every day. Less than 2 bowel movements per day. Straining at the stool. Feels like there's still stool in the rectum after a bowel movement. Stool consistency is not formed, or the consistency of peanut butter. Rectal fistulas. Rectal bleeding.